The following is a presentation of Project Independence and WCWP. Project Independence is the Aging in Place initiative of the town of North Hempstead.
Welcome to Project Independence and You.
Good morning and welcome to Community Talk Radio. This is Project Independence and You on LIU Public Radio. I'm your host and producer, Kristina Liu. And today I have my two co-hosts, Otto, Lohse, and Paula Yule. Paula and I work together at the town of North Hempstead. She's the Deputy Commissioner of the Department of Services for the Aging. And of course, Otto Lohse, everyone knows and loves, is our PI volunteer and all around great guy.
Well, I love you.
Well, that's how we like to start our mornings off. This morning, we are talking to Maria Alvarez, who is the executive director at the New York StateWide Senior Action Council, Incorporated, just about all the services that your council provides. And especially, we were very intrigued by the Medicare patrol and just Medicare fraud prevention in general. So welcome, Maria.
Thank you so much for having me today. I'm really, really honored and happy to be here and talking to you.
Great. Well, let's just dive in because, we originally found you because of the ACL.
Right.
And we saw I was on the newsletter and I was like, we're always talking about fraud prevention on this show. But then in diving into it, there was so much more to this New York statewide council. So if you could just give us an overview about what that is and what you guys do.
So New York Statewide Senior Action Council is a 52-year-old organization. We were founded through the War on Poverty funds in 1972. Mm-hmm. And our mission is to improve the lives of seniors and families in New York State through education, advocacy, and services. One of the different things and what we like is that we're consumer directed and governed, meaning that our board of directors is completely made up of consumers, people 50 and over from all over New York State. We have 10 chapters throughout New York State that are regional. And so what we do is we hear from the people who are actually being affected by any policies or anything that's happening. And it's not only to hear what the problems are, but we like to be part of the solution. That's why our name says action, Action Council, we take action. So the way we accomplish this is through, I would call it a three-pronged approach. So one of them is obviously our members. We're a membership organization. And so anybody can join as long as you're, New York State resident or organization. We have organizations as well. And we have chapters that are led by volunteers, by the same consumers, right? Mm-hmm. And then what they do is they get together, they identify what is going on in their community, and then they work to see how they can, improve things. However, we also have a statewide board. So we get representation from each of those chapters that come to our statewide board. And then from there, that's where our governance occurs. Throughout the year, we also have set several committees. We have a public policy committee, which is represented, by each chapter. So we work on different issues that the public policy committee they sort of monitor. However, once a year, and I'll tell you more about it, it's very exciting, but once a year, we hold a convention where our membership gets together. It's in Saratoga Springs every year. And number one, we learn, we invite a lot of the top speakers in the field of aging and anything that's happening. But the last day of the convention is the day when our membership actually votes on federal and state legislative agendas that's basically our marching orders for the rest of the year of how we work. And the public policy committee serves to monitor how things are going and to also let everybody know we're a grassroots organization. Mm-hmm. So, a lot of it is community building. So then the other part of how we accomplish our mission is we operate 3 helplines. We have the Managed Care Consumer Assistance Project, which is to help people navigate the healthcare system. It can get very, very complicated once somebody retires, and or even if you're already retired, but the plans change, the healthcare plans change, prescription drug affordability is an issue, things like that. So our counselors are trained and certified. We have the same training and certification as the state HICAP system does, the health insurance, for the state. And so we provide those services. And then we have a patients' rights helpline, the Bill of Rights for patients that you see in hospitals and institutions. Our organization was the one that made sure that it occurred in New York State. And then finally, our Senior Medicare Patrol Program, which is federally funded. And we're very proud of it because there's only one per state, and we're the ones in New York State. And what we do is we help prevent, detect, and report Medicare fraud to the government, to the Office of Inspector General in Washington. I just want to make sure that that the listeners understand all of our services are free. We receive, for these helplines, we receive funding through the government, through the state, as well as the federal government. So we're unbiased. We don't sell anything. We do not tell people sign up for this or that. Our aim is to give people the best information so that they can make the best decisions regarding their health care. We make presentations. We have 4 offices around the state, but we make presentations anywhere. Our helplines are accessible from any point in New York State, but we do a lot of community presentations, which is nice because then by going out, meeting people and hearing firsthand what is happening, then we're able to see, number one, if our board member came and talked about it, that's one thing. If somebody's calling us on the helpline with the same issue, then we understand that. And then coming into the community and hearing it again, gives us the understanding of how policies are being put into practice and how it's affecting seniors. And then from there, then we are able to say, well, this might be a problem, that then we speak with our elected officials and we're able to affect change that way.
Wow, I know. Wow. Well, I think, we wrapped it up. That's about it. We can go home now.
Yeah.
How do you become a member? Like you said, the
Otto, you just
membership
took
is
it right out
made
of my
up
mouth.
of people like myself, I guess.
Absolutely. Yeah, it's just a membership. We have forms that you fill out, but it's basically a membership is $20 a year. So the price of a magazine subscription, right? And for an individual, a couple, I think is 25. And then, but we have lifetime memberships, things like that. But we keep things nominal because we want to make sure that as many people can attend and participate as possible.
How do you get the paperwork, and how do you go about doing it?
Yes, well, we have physical brochures that people can sign up, but we also have a website where you can sign up. And our website is NY Senior, like New York Senior, nysenior.org. And our helpline is 800-333-4374.
Now that helpline, is that the main, like all your different
That's
help? So-
everything goes to that
So you just call it that
Yes.
once. Okay, perfect.
Yeah,
So that's the
because
main number.
just to make everything
Yes.
simple.
That's what we
call
like.
one
Yes,
number,
we like to simplify
one-stop
things,
shopping
right.
there. You call
Great.
for anything you want to ask about.
Anyone can call. You don't have to be a member.
No.
Anybody.
Yes, no, that I want to make sure
Sure,
everybody
yeah,
understands that. Even our chapter meetings, anything that we do, we have telephone teach-ins every month where we get experts to come and speak about different issues. Those are open to the public. Everything we do is open to the public. The way we see it, we want as many people, regardless of their age, even, to participate. because our mission basically is to spread the information and to hear what's going
Yeah, I
on.
mean, to be honest about it, I was always in marketing and sales, so that's, my brain says right
Oh.
away, this sounds great.
Right,
How do you get the
get it
word
right.
out?
exactly.
You know, like, to be honest, again, I really didn't know about this. until
Yeah,
you're saying
right.
it Right now.
I know. Well, that's part of one of my objectives, because I go to places and they'll say,
Yeah.
"Oh, I've never heard of this before,"
Right.
or my members will come and say, "You know, I was somewhere and they said this is the best kept secret." Well, I don't want to be a secret. I want
Yeah.
anything I tell anybody, I want everybody to spread 1,000 times over.
Where, like you said, there are 10 chapters.
Yeah,
What would be
where?
the closest chapters to this part of the world?
Oh, well, we have a New York City chapter
Right.
that encompasses all 5 boroughs. We are looking, we're always looking to expand wherever there's interest, in these
There is
chapters.
no Long Island.
There's no
chapter.
Long Island chapter, but I would
That's
be,
why we probably don't
Yeah.
have it, right? Yeah.
but we would love to begin one here. I was
Wow.
just saying before that we're looking to work more, more closely with people on Long Island. We have members that are at large who are from Long Island, but they haven't really gotten together.
Yeah, I mean,
to-
again,
as
the
a chapter.
marketing
Yeah.
part of it, there's a lot of seniors out
Yeah.
here.
Yeah, I mean,
Yes,
it's certainly
absolutely.
it's growing.
Yeah, and
Absolutely.
growing every
Yeah.
day. Yeah,
Yes, well, they say that in the United States, 10,000 people age in, become 65 and over every
Yeah.
single
Yeah.
day.
Yeah,
So
well.
It's great.
And
Well, I think we're
and
gonna need you at our
like the idea
advisory,
that
is what
you
my
have
brain's
your-
like.
Right, right,
You ha-
right.
You
Yep.
have your convention in Saratoga Springs. Do you happen
Yes.
to do that in August when the horse race?
I knew Otto, I knew this was
That would
coming.
be
As soon as the
amazing.
word Saratoga came out of your mouth, I knew Otto was going, his wheels started turning.
Say, I'll be a
Beautiful.
member.
Yeah. Well,
I'm going.
Right, yeah. Well, it's in October 21st
Oh.
through the 23rd. But it's still beautiful in Saratoga Springs at
Yeah,
that point.
well, it's nice
so
country.
Yeah, it's very
yeah.
nice. We're staying we're at the Embassy Suites this year, so it's right next to the strip, that whole
yeah,
downtown
right.
strip.
Lovely.
So you
right.
could always take a walk there and,
Right.
we
There's
do
a lot of good
tours.
restaurants
Yeah,
and whatnot.
tons of
along there,
nice,
right?
yes.
Yeah.
Yeah. So how does the chapter actually start? Like, how is it organized?
It's organized by interest. Obviously, we want to be where people, because they're run by volunteers. So
Okay.
people have to want to,
Mhm.
to be, and usually if there are about 10 people who are, we need 10 paid members who would be interested in forming the chapter.
Okay.
And then we support, the main office supports the chapter,
Mhm.
to make sure that everything, that you have everything that you need. But also we have, bylaws that then
Right,
template
right,
bylaws
right.
that then you could look at, and, each chapter has their own, their own schedule, how long do they want to meet? It's all up to the
Okay.
members.
Okay.
But but the
Interesting.
idea is that they would want to be part of, of a larger organization. They're independent, but they're
Right, yes,
affiliated.
Yeah.
Mhm.
And then becoming a chapter then means that they get representation at our statewide board,
Right. Okay.
which is important because then they vote on the governance
Yeah,
of
that's
the
amazing.
organization.
It's
We meet
great.
3
Yeah.
times a year in Albany.
Yeah.
Project Independence is kind of a mini organization like you're talking about, in that
Mhm.
they have advisory committee meetings once a month.
Right.
And it's a grassroots level thing.
Yeah.
They're talking people, Paul and Kristina, and nurses and social workers about what the needs of the people in this community are. And, it's how it started, and it's.
Yeah, and that's that's
Yeah.
where things happen, and because what you were saying is certainly our kind of mode of how we do it, but we
Right.
have our our town local officials that really support our programs, so we have them, and then it's our seniors, and of course our staff, and that's where issues are discussed too. So I think that's what I was saying to Paul, I definitely going to schedule you for one of our advisory
Right,
meetings,
right.
because I think a lot of people would be interested,
And staff meetings,
Yeah,
too.
because it's just
Yeah.
too, I think we have such robust seniors in North Hempstead that certainly would want to, have a say on, programming and legislation things. So
Absolutely. I always say that consumer
Mhm.
voice. We pride ourselves in being the consumer
Yeah,
voice, because many times
absolutely.
you go places and you hear from the people
Mhm.
who are working, with
Right.
them. But
Yeah, yeah.
for us, it's like, well, if you have somebody that is actually participating and knows the community,
Mhm.
most of our members are on first name basis with their elected officials. When we
Yeah.
say,
That's
let's
wonderful.
do a lobby day in Albany, and they'll say, okay, great, but you know what, I'll in the meantime I'll go visit,
Mhm.
and they
Yeah.
call them by their first name.
Yeah.
It's great.
Yeah.
Yeah, I'll go visit in the office and I'll tell them I'm coming.
Yeah, but the assessment piece is so important.
Yeah.
It's not just
Absolutely.
that X policy was made or however you develop the policy with a group of people. Once the policy gets implemented, if you don't go back and get that feedback of, is it really working? And that's part of, as we were growing, we would put something out, and frequently we would pilot a program or pilot something that we thought was needed, and then really take a step back and say, was it needed? Do we need more? How do we allocate these resources to our seniors? But when you were talking about that, I thought it's not just we meet, we go, we say, here's the policy, but we really
Yeah, it's like
back
an
and say
interactive kind of,
feedback.
and that,
Yeah.
I think that's what
feedback.
makes,
Yeah,
makes
so
a program
important.
successful, because as you said, they're the ones that are in the
Right.
community.
Using
And what's
the
always say about
service.
our seniors, Otto, started on our very first advisory committee, and it's really,
2006.
yeah.
Oh,
The
wow.
First
Yes, he is.
advisory
Say
meeting.
what? Yes.
2006 was
2006.
April 2006 was our first advisory, and you were there,
Yeah.
present, and already working
Well, and
in your volunteer
18 years.
capacity.
And we haven't let him
Yeah,
leave ever
yep,
since.
18
it was
years.
all of these things, like most people go through things in their life. Like my mother lived with us
Right.
for 11 years, right? My wife and I were both working. It was like, where do we go?
Yeah,
And it was like, okay, make 480 phone calls to find out something.
Right.
And with this concept, by that time my mother was gone, but I said the concept of being able to call and have a nurse or a social worker to sit down with, who assesses your situation and can guide you through their partners that they've developed.
Mhm.
They don't do the work necessarily. They guide you through the system and where to go and who can help you
But
for
that
your
is
problem.
that is so
Right.
important.
Yeah.
Right. And
Well, guys, there is so much to talk
Yeah.
about. And after the break, we will continue talking with Maria Alvarez, Executive Director of the New York StateWide Senior Action Council Incorporated. You're listening to Project Independence and You on LIU Public Radio.
WCWP is your home for great music and great conversation. You'll find all that and more on WCWP.org. Listen live on the web, check out the lineup, subscribe to podcasts, and stay up to date on the latest station events. Get in touch with us and let us know if you like what you're hearing. And find out how you can support or get involved at the only community public radio station serving Nassau's North Shore. Plus, sign up to get a free bumper sticker. It's all online at WCWP.org.
Welcome back to Project Independence and You on LIU Public Radio. I'm your host, Kristina Liu, and I'm here with Paula Ewell and Otto Lohse, and we're going to continue talking with Maria Alvarez, who's the Executive Director of the New York Statewide Senior Action Council Incorporated. So much to talk about, so much information. I mean, all of us, during the break, our wheels are certainly turning. Now, with the helplines, so you said there's the managed care community assistance program. So what's like a typical call that someone might, use that helpline for?
It's obviously it's operational all year round, but especially during the annual enrollment period, when
Perfect,
people are
yeah.
selecting their healthcare for the year,
Mhm.
or it could be that you just retired and you don't know, because New York has over 40 plans. that
Yeah,
people can
it's very
select.
overwhelming.
Yeah.
This topic
Programming.
certainly has come
Very-
up
yeah.
numerous times.
Yeah.
And it doesn't matter what your educational level is
No.
or anything like that. It's just very complicated. So somebody can call and say, I'm just retiring. What should I do? And we walk them through not only to pick the plan, but what you have to do before, to be able to qualify for that plan, right? And so we do that. You could do that. Let's say somebody's prescription drugs, are not covered, or they're looking for a prescription, Part D is
Mhm.
something that people need to have. We can help them apply for the EPIC program, the Elderly
Yeah.
Pharmaceutical
Mhm.
Insurance
Mhm.
Coverage, which, by the way, is the statewide was the one that got it signed into law with Mario Cuomo, Governor
yeah.
Mario
Yeah,
Cuomo
that's
back
wonderful.
back in
Yeah.
1987.
Wow.
we fought for that because, prescription drugs were just so expensive.
Still,
And
yeah.
they still
Still
are,
are,
and
yeah.
we're obviously things are getting better,
Mhm.
but New York State has this program that for people who qualify, they won't pay more than $20 for a prescription drug once they hit the catastrophic
Right,
stage.
right.
It used to be a much better benefit, but it's
Yeah.
watered down a bit. But so just to give you an example of this, not only did we make sure that it got passed into law, but then we monitor it as the years go
Yeah.
by. And through our advocacy, we were able to get it expanded so that more people, income wise, are able to qualify for the
Is this the high cap program, or is that a different?
It's high cap, it's exactly like the high cap
Right.
program,
The same
except
training,
it's called,
right.
yes,
Right.
it's MCAP. And the only difference we have is that this program gets funded through the state legislature as opposed to the federal government, which is how
High cap,
how
yeah.
the high cap
Right.
program gets,
Right.
but so when we see things like the EPIC program, the other thing is that the Medicare savings program, where, one thing is to qualify for Medicare. The other thing is to be able to afford it.
Yeah.
Right.
So there are many people who were not affording, out of pocket costs are, can get very expensive. Drug costs can get very expensive. Through our advocacy and what we see on the helplines, and, like I was describing before, we got together with some other organizations that we work with in coalition, and we were able to get the New York State legislature to raise the threshold so that more people could qualify for these programs
Right.
that help you with your Part B expenses, with your EPIC expenses.
I think
And-
Epic is like $100,000 income now, or
yeah,
something like
that's
that.
the threshold
Right.
for couples, 75,000 for singles.
Right.
But it used to be half of that
Mhm.
Yeah.
before.
Yeah.
So we were able to get that. But then with the Medicare savings program, it's wonderful because now 300,000 people 65 and over in New York State qualified, would qualify, more people would qualify for this. And now the catch is to get the word out.
Yeah,
Absolutely.
right.
That's what-
Because the issue is all of these programs exist, and what you were saying before the
Right.
break is super important. What their job is super important because they want to make sure that people are accessing programs that they qualify for.
Right. And people really have no idea. I mean, that's
No.
that's what we come across
Uh,
every single day.
I can tell you from a
Every single
different
day.
level, 95% of the people who I'm talking with, and you talked about education level and whatnot, it really doesn't matter.
No,
They still don't
No,
know.
right.
And I've been doing this for a few years
Mhm.
now, and I've been educated because of it.
Yeah.
And like I said to you at the beginning, I didn't really know about this
Right.
per se. I heard the name, but
Right.
it didn't register, you
Right.
know.
Yeah.
Right.
And we
So-
actually, we run a program every year, again, during open enrollment, where our nurse coordinates with a wonderful pharmacist from St. John's, and they come in and people can sign up for like a brown bag, so they bring in their prescriptions or their list from the pharmacist. And I can't even tell you.
Yeah, the
I don't know
amount
if
of
you remember the
savings,
last number, thousands
Yeah,
and thousands
yeah.
and thousands. And every year we tally,
The
how
cost
much,
savings,
and that's
yeah.
just the
Yeah.
people that signed up to come to this.
Right.
And we run a couple of them, but again, the more people that participate in that, the more money they're going to save. So,
absolutely.
you know,
And so there's a statistic out there that says if somebody is not accessing one federal program that they qualify for, let's say HEAP, let's
Right,
say
right.
housing, let's say MSP,
Mhm,
the
mhm,
Medicare savings
mhm.
program, they probably are not accessing 3 or 4 other programs.
Right.
Yeah.
because they're
right,
automatic.
right,
If
'cause
you
they're-
get
Right.
one,
You
can
qualify
automatically
for the
qualify.
others.
Right.
Yeah.
People are leaving $12,000 on the table.
Right.
Yeah,
It's not that
wow.
you're getting the $12,000 in your pocket, but if you're
Yeah,
not
over time,
spending it
right.
on all
Right,
those other things,
Right.
I mean, what can you do with
Right.
$12,000?
Right. And
We
that's we
talk
do.
about it
Yeah.
on here a few times
Yeah.
that the whole world of pharmacy or drug pricing is like a jungle. It's like, I don't get it.
Yeah.
And we talk about even if you have a prescription, I mean, an insurance plan, I'll go on GoodRx sometimes,
Mhm.
and it turns out that was 200 is now 40.
Right.
I mean, you're talking not like saving $1 on a coupon.
Right.
Right.
You're
No,
talking
no.
No,
big
it's-
numbers. Yeah.
Exactly.
And
It's
that's part of
significant.
our financial assessment when the social worker goes in, is really just to look at, first of all, obviously people have to be comfortable with calling us, B, we come into the home and we develop, supportive and trusting relationships. But when you sit down and look at people's budgets, you can see that, wow, you might have had $70 more to spend on food or to
Exactly.
spend on whatever your need is, if you are signed up for this, and then we can help them actually sign up. So it's the nuts and bolts, but then we stay in to make sure it all came to fruition. Like the whole,
Absolutely.
we close the circle, we start, we look at it, and if someone doesn't need it, okay, but
Wonderful,
call
yeah.
us again if you want to, and it's really just
Right,
You
the
used
awareness is-
magic
Yeah.
word there,
Well,
trust.
trust,
All
yeah.
Right.
Trust is
Right.
big in life,
Absolutely.
and it's big in this kind of thing.
Right, yeah, and
Yeah.
that's our training.
Absolutely.
You know, but I think like
especially
with,
with
your
seniors.
council, what's, all these things is, getting the word out and the education piece. And I think that that's what's so huge. And that's why I love doing
Mhm,
the show,
mhm.
because we have a place that we could have amazing organizations like you who come on and,
Yeah.
spread this, because listen, we're in the field for many, many years, and to know all of these great things, I can't wait to go back. And now we get to tell this to our social workers and our nurses. So it's part of
Right.
their toolbox,
Right.
and clearly too, we'll preach the word to, all of our members. So it's definitely, I think, so important to access these things. And listen, I mean, we're certainly all can agree that life is very expensive,
Mhm.
especially on Long Island, right
Yeah.
now. So
Yeah.
I think being able to access some of these programs where you can really get so many benefits is just absolutely huge. Just
Yeah.
really, really great
See, if I
stuff.
were a member of a chapter, I would give you 3 things, all right?
Oh, here he's already thinking about it. You
That-
might have had the
and
Long Island
I-
chapter might have
Yeah,
been
we might
born
have-
this morning.
And I
Ladies
know
and
you-
gentlemen.
And I know I've heard the name on one of your sites that I looked at, nursing homes and the cost of all of that stuff,
Yes.
hearing aids
Mhm.
and the cost of that, and dental
Dental.
programs
Dental.
and the cost of that.
Big.
The typical senior, Medicare is very helpful, and it really helps with typical medical stuff. It really does. But those areas are like a huge hole
Mhm.
that put people into the
Yeah.
poorhouse.
Yeah.
Yeah.
Yes.
Or people don't get the services that they need.
Yeah.
They
Yeah.
don't
And
go to
all
the
of
dentist,
those, as
which
far as that
impacts your
goes.
cardiac, all the things
Right.
that your
Yeah.
health is impacted by not getting the dental care. Or,
Yeah. And I
not
mean, to
being able
me, even
hear,
my,
you're
frankly,
gonna
my
fall.
biggest expenses are hearing, got
Yeah.
hearing aid,
Yeah.
Yeah.
and the dentist. The dentist is like,
Yeah.
every day you go there, they find something else.
Right.
And
Yeah.
yeah.
Well,
Yeah.
it's tragic because
Yeah.
Medicare does not cover dental care unless it's for a medical reason,
Right.
right? So it's terrible because once you turn 65, then people stop going to the dentist and
Because
then
it's
they
too
get very
expensive.
sick.
Yeah.
Yeah,
Right.
because it's not covered.
Yeah.
And so, I mean, obviously, one of the things that we're advocating for, not only that, we think Medicare should pay everything, but that people 65 and over should be able to buy a good dental plan if they can on the exchange. Because right now
Right,
you're not
right.
allowed to
No,
do that.
right.
You can go to Advantage Plan, which is
Which
very
is very-
misleading.
And it's minimal. Yeah,
Like they'll give you 2 cleanings a year.
exactly.
God forbid you have anything beyond a cleaning,
Right.
like a
right.
nice $10,000 dental bill,
Right.
which can happen
Right. If you
easily.
get an implant,
Yeah.
if you get an implant, forget it. It's
You're-
$10,000 to $15,000 right there.
Yep. I'm there right now.
Yeah.
Yeah.
No, and to find a good dentist, oral care in New York State is really in a precarious position because, if you go to rural areas, even urban areas, to find dentists that first of all, dentists at all, but secondly,
Yeah.
that would want to take, Medicaid even or
Right.
Medicare, they don't. I mean, the dentists want to be out, I've
Well-
talked to enough of them where they'll say, I'm happy with my private pay. I don't want to take any insurance.
Well, that's where trust comes in
Yeah.
And,
Exactly.
do you need a cap? Not really, but I can give you a nice cap for $4,000.
Exactly.
Kind of mentality,
Right.
unfortunately. And I'm not saying all dentists.
Right,
Right.
right. Yeah,
uh,
but I think
but-
sometimes too, like, it's not just lack of information to people, it's, there's so much that comes in.
Right.
Like,
You don't even know where to
You
begin,
don't
how to
know,
sort
like,
through it.
just
Absolutely.
in
Yeah.
our world, like,
Right.
we get all the ACL, we get all the emails and things are coming in. Yesterday we got the NYSOFA newsletter, which we get every month. And then I
Right.
get the Nassau County aging newsletter, and you go through that and make sure. And some of it just boils down to some basics. Like a lot of the programs you're just talking about, they exist, they're helpful, we can connect people. So just getting the word out on, here are the basic things that you may be eligible for.
Right.
Let's start there. And I
Right.
think in our program, that's where we're very fortunate, because we can have two people sitting together saying, what is it that you need? And
Right.
so that's why we're very, very lucky. But we see like so much information come through, and you really have to get through it all.
But there's still always a reluctance by a lot of seniors, because I talk
Yes.
to a lot
Oh,
of them about
absolutely.
what Project Independence could do for them, and they
Yeah.
don't take advantage of it.
Yeah.
There's a mentality that I don't need
You don't need it
charity.
yet. Right.
Right.
That it's even
and
charity
they're
and it's
trying to sell.
taxpayer
They're
funded.
trying to sell me something.
paid
You
for
used
it.
the words in the
Right,
beginning.
you are paying.
You
Yeah.
used the words in the beginning that your organization is not trying to sell anybody
Right.
anything.
Right.
Right.
And a lot of seniors have this thing that they think whoever's talking to them deep down is trying to sell them something.
Exactly.
And so
Right.
trust, in the case of Project Independence, they have a continuity that builds trust.
Mhm.
You don't build
Right.
trust in one visit.
No.
Right.
It takes time.
No.
And
And especially the pieces, and I know reading a little bit about, your program, is people come in and out of the hospital.
Yes.
That whole process of going into a hospital, being discharged, what are their patients' rights? What are their rights upon discharge? What happens when they get home? Now what?
Yeah.
We
Oh
know
my gosh,
Medicare has
yes.
such basic coverage, really just
Right.
to transition you back to the home. And then what do you do? And those are the pieces where, in a local sense, our partnerships, we know who to call.
So important.
We-
That
okay,
patient
you call
patient
here,
navigation is
It's like so
extremely
important.
yeah,
And,
who's in
it's
charge of me when
complicated.
I'm laying there?
Right,
Yeah.
exactly.
Yeah.
And if you're alone, especially, like if you don't
Yes.
have someone to help you, it's so overwhelming. And you're
Absolutely.
signing documents on discharge, and the nurses will go in and look at discharge instructions and say, wait, this doesn't make sense.
Right.
This shouldn't be here.
Right.
You didn't get this durable medical. This should have been here when you got home. And
Right.
there's just so many pieces
I mean,
that,
it starts like,
it's
I've been
it-
there myself, where
yeah.
I'm like the advocate.
right,
and
right.
If
And you
you don't
look-
go checking with everybody on the planet, you
Right.
don't know who the doctor is, who's
Yeah.
in charge of
Exactly.
this
Yeah,
person.
it's
Or
complex.
who should I ask questions?
Right.
Right.
Hopefully you don't have to just rely on the nurse who comes in and out.
Right.
Not that I'm knocking the nurses, thank
Right.
God they're there, but
Right. And there's so many, there's actually a lot more programs, like health delivery programs that are available now. Like Northwell, has a rehab program, and our nurses are great, where they will stay in doing rehab at home
Right.
much longer than they may have
Yes.
been getting. And
And
you
there
might
are
not have known that.
programs,
And
right.
usually a couple of weeks, you're not going to be ready.
And there are programs where Medicare will actually
Pay
pay for
that,
you
yes.
to get
Yes.
therapy at home.
Right.
Where you thrive, right? Everybody
Right,
likes to be home.
absolutely.
You don't want to
Well,
be
I
in
think this is a
an
perfect little
institution.
segue into your patient advocate program
Mhm,
helpline
sure.
also.
Yeah.
So
Yes.
with that, so what would people call? Is that something that you're calling when you're in the hospital, or like how does that whole helpline work?
Well, that helpline is basically to help people understand what their patient, what their patient rights are in an institution, if
Mhm,
they're a resident in a nursing home or in the hospital. It's important because many times they, discharge planning, we were
Planning,
just
yeah,
talking
yeah.
about it. Many times people will say, they'll call and they'll say, I'm not ready to go home. I
Right.
don't have a
Right.
proper discharge plan. I
Right.
don't have somebody to, and sometimes the nursing homes or the hospital wants that bed.
Right.
Or
Tomorrow.
maybe, yeah.
Yeah.
And so, so they, and there are certain things that you can, that, you don't have to leave if you're not ready, if you don't
You
feel
can appeal your
Right, you
discharge,
can
and there's a
appeal-
process.
Right. And so we can help give people that information, and, sometimes we even intervene.
So that was my
Yeah,
next question.
yeah.
So if someone is, because I'm thinking of a senior who is alone in a hospital,
Yes.
it's very overwhelming. So I was wondering if your advocates are able to, actually do some of the talking,
Yes,
or
we definitely, talk to them, but also, because sometimes, what it is, sometimes even the staff in the hospital, they're overwhelmed
yeah,
themselves.
of course. No, there's so many
And,
layers.
Then the other thing is a connection with the ombudsman program, which
is also
needs help.
Yeah.
Stretched to the limit.
But they can actually get into the facility
Right.
and
Get
and
right to it.
advocate right,
They can get
right
to
there.
it. Yeah.
But otherwise, we have we know what we can do and who to call and to help to make sure that those.
Yeah, this is just such a
patients don't-
huge service, really, because I know, we've certainly dealt with so many people, and especially, and it's overwhelming for anyone of any age.
Absolutely.
I think that, but with my own mom, there was times that I had to advocate, and she's very, robust, but it's
Right.
it's just a great
and
service.
during COVID, we this particular issue, just
Oh my gosh.
exploded with so many seniors in nursing homes and things like that.
Well, after the break, we're going to continue talking with Maria Alvarez, Executive Director of the New York Statewide Senior Action Council Incorporated. You're listening to Project Independence and You on LIU Public Radio.
Take WCWP with you wherever you go with the WCWP app. Listen live 24/7 to all of our streams, all from one app. Plus, call the studios directly from the app and visit our social media. Download the app through the iOS App Store on Apple devices or the Google Play Store on Android by searching WCWP Radio, or visit WCWP.org for links. The WCWP app, available now on iOS and Android devices.
Welcome back to Project Independence and You on LIU Public Radio. I'm your host, Kristina Liu, and along my co-hosts today, Paula Ewell and Otto Lohse. And we are talking about so many important issues and all the services that Maria Alvarez over at the New York Statewide Senior Action Council is providing. So many important, just incredible services. And I can't wait to spread the word.
Right.
I can't wait to go back to the office and tell all of our social workers and nurses these great things, because I think it's so key. And before the break, I know we were touching upon all the different helplines. And Otto, do you have some questions you wanted to? I don't want to skip over. I know you had some hot
said
topics.
something about people in most situations being stretched to the limit.
Yeah.
I don't know too many jobs where people are not doing more work than people used to do in those same jobs.
Yeah.
And I think the reality that has to be accepted by people like me, anybody who's a consumer, is that this is the case. All right. So you have to be somewhat patient with this process, which is not always easy.
No, because you're stressed. There's
Yeah.
so many layers,
Yeah.
and that's where it gets complicated, because everyone, and I know that's, if you want to get out, you want the plan, you just want to.
Well, you
just
think your deal is it. All right.
Yeah, but the reality is that there is a shortage of
Yeah.
nurses and staffing
Yeah.
in hospitals, and it's something that we have advocated for, to make sure that there's a staffing ratio.
Yeah.
Because what happens is, of 3 to 1, there
Yeah.
should be 3 patients to every nurse in any hospital, there are all these battles that go on. Hospitals saying that they don't have enough funds,
Yeah.
but
It's hard
there's
to
other
believe that.
hard to believe, right? But we have to keep on fighting to make sure, because again, people die,
Right.
and it's a very serious thing.
Right.
So, the other thing I wanted to say, and I cannot leave here without saying it, is that, in 2 years from now, and probably here it's happening already, people 65 and over, seniors, are going to be 25% of New York State.
Yeah.
We probably have more
Hempstead
here,
is,
Yeah.
I think we were close to 20, were we 20?
Yeah.
We were
Yeah.
way up there.
Mhm.
Yeah.
So in my mind, as being, heading up an organization that deals with our population, anything that happens in society has to take into account
Yeah,
who we are
absolutely.
and what are our realities.
Mhm.
Not only that, though, when you look at healthcare, seniors, 65 and over, the Medicare population, they're the largest consumers of healthcare,
right?
and the most and costliest healthcare as well. Meaning that if they're going to develop anything, if there's going to be anything that goes on in those hospitals, whenever I hear, oh, we have a plan, you're talking about us.
Mhm.
Yeah.
And we need to make sure that whatever it is that you're going to do, make sure that it's going to fit our reality and not the other way around.
Yeah, and
Yeah.
part of that really is the younger 75% realizing that they're going to be in that 25% one of
Absolutely.
these days.
Yeah,
Well,
you want to
yeah.
have
You
these
know,
things enacted,
We
right?
didn't all
Yeah.
start out at, at this
Absolutely.
age, right?
Absolutely. And like your story at the beginning, you were looking for things for your mother. You were a
Right.
caregiver. Those caregivers are eventually going to be the people that need the help.
Right.
So, and sometimes they already are. So it's important. This whole infrastructure of healthcare, of society, of, not just getting by. We want to live with dignity
Mhm.
and, economic security.
Quality.
And
Yeah.
absolutely.
Yeah.
And we deserve it. We contributed, we paid into it, right?
Right.
There was a promise. This is
Yeah.
the time, pay up, right?
Agreed completely.
Yeah.
It's
And I think that's
complicated.
partially how we started also in this program. It was, seniors paid taxes
Exactly.
30, 40, 50, 60 years. And how are we helping them now? So
Exactly.
Well,
our
luckily, the
town
life
board.
expectancy is a lot better now than it used to
Yeah.
be. And the quality
And
of
the
life
quality of
is
life.
also better than it used to be. Like you guys keep saying, there's a many 100-year-olds walking around who still are
Working
Yeah,
quite
but,
and
no
that-
capable.
But and that's why it's so important to have these kind of policies enacted in middle because people are living longer, so you're
Absolutely.
using more of the healthcare system over the span of things. So you want to have all these kind of things,
Right. And
in
I
order.
mean, I believe that the way that we approach life has to even change
Right.
because, when Social Security and Medicare were founded, the life expectancy
Right,
was
they
like
weren't
68.
anticipating,
You were going to
Very
live off of
different.
that 2 or 3 years.
Right. Yeah.
Right now, the person who's going to live to 120 is already born.
Yeah.
Yeah.
So,
Right.
and then when you think about women,
Yeah.
right? Women who maybe, at some point they went to be with their families, right?
Mhm.
They had children or they took
Mhm.
care. So they come in and out of the workforce.
Yeah.
Right.
When they're finally of age to, of retirement, number one, they're going to get less because they were less productive,
Yeah.
not that
Right.
they, at
Yeah,
home,
right,
they were
right.
probably more
Yeah.
productive, but women make less money, 80 cents on the
Yeah.
dollar. So, and we live longer. So
It's always
we're
been
gonna-
wrong, by the
Yeah.
way. I've been an advocate of that.
Absolutely. But so now we have to live a
So there are
longer
more in
life.
Yeah.
poverty. There
On
are
for less
more
money, right.
struggling-
Right, on less money.
Right.
And then if you're retiring traditionally at 65 and you're going to live to 120, that's half of your life. So
Yeah.
what are you doing with
Right.
the
Right.
rest of your life? Not only, how are you going to spend your time, right? You want to
Right.
be with your grandchildren, you
Mhm.
might want a hobby, a second career, whatever it is, but your resources that you are
Yeah,
your wealth
limited.
building has to
Right.
live
Lasts
a
a
lot
long time.
longer.
Yeah.
We
Then-
call it here rewirement, all right? You're
Yes,
rewiring.
that's Otto's
is-
buzzword. Yes, he
Otto,
likes
I
to
love
share
it.
it
Rewiring
together.
your life,
I
basically.
love that.
Yeah.
You know,
That's wonderful.
yeah, you're not retiring, you're rewiring. Do something new or
Right.
do something. Don't
Exactly.
do
Something.
nothing.
Right. Right.
Exactly.
Yeah.
So, yeah.
Yeah.
And it's either whether you would, because you want to, you're an active person, or maybe you have to, you need to supplement your
Well, I
your
mean,
income.
money is a big factor, whether
Absolutely.
we like the idea or not. If you don't have it when you get older, that's a problem. It's a
Right.
big
Well,
problem.
one of our projects is called the Elder Economic Security Index, and we partner with the National Coalition on Aging and the Gerontological Institution of the University of Massachusetts.
Right.
But what we do is we calculate the average cost of living for a senior 65 and over, whether you're a single or couple, whether you have a mortgage or you're renting or you're an owner without
Student
a
loans.
mortgage. Yeah,
Student
no, but then
loans,
we
really.
calculate how much money does it cost you to actually live in the community?
Yeah.
And usually, because the federal poverty level is like $14,000 a
Right.
year,
Gosh.
it in different counties it costs differently.
Yeah,
And
right.
this
This is
county we're in
rough.
is
Yeah.
one of the highest
Yep.
amounts for the
14,000
entire.
is not going to go too far.
Right,
in
when
this
it costs you
county.
$35,000 to
Right.
live bare
Bare.
basics, it's not like you're living the life, right?
Right.
But you make $14,000, there's a big gap. So there's a big gap. And that's why we do a lot of the advocacy that we do, because we need to make sure that these programs are, are realistic for people to qualify for. If
Yeah.
not,
Yeah,
we're
yeah,
gonna,
yeah.
so
You know,
that's
some
one
of
of
it-
our other projects. that
Some
we
of
do.
it really, I mean, I'm an older senior. Some of it though comes down to being educated when you start out. Like in our school system, we ought to really
Right.
people.
Yeah,
I
like
know,
planning for retirement.
Yeah, I mean,
no,
no,
it's
but
true.
like
Yeah.
talking about the reality
Yeah.
of your money.
Right.
Yes.
Don't spend $800,000 on your education, and don't spend $40,000 on credit card bills that you're going to pay
Or a car.
forever.
Right.
I think we
Right.
got to really get it
Teach
through people's
budgeting.
heads when
When
they
they were,
Basic,
really?
remember
basic.
when you were in
Basic.
school, in grade school, they had the bank officer come to your, I
yeah,
don't know
with
if
the
you-
savings.
Yeah, the
thing. I had
savings to
that.
learn about
East
that.
New York Savings
Yeah,
Bank. It was
right.
called.
So things like that, they don't do that
Yeah.
anymore. But I think it's important because that, like, to your point, it starts when you're a child.
Yeah, I
It's
mean,
habits.
you can, like, I know a lot of people that have lived a good life, and now all of a
Mhm.
sudden they're getting into the category where their good life is costing them
Yeah.
because they
Right.
have nothing
Right.
Yeah.
now.
Right.
Right.
You know,
Right.
And that's the point. We are seeing people who were traditionally, middle income sliding into poverty.
yeah,
And, so we just said that 25% of the population is going to be 65 and over. If those people are poor, then what are we going to do?
Right.
Yeah.
So we
And
need
what's
to
that
figure
gonna
something
cost?
out.
Right. Yeah.
Well, I also want to, we've hit our 2 helplines, and then there leads us to the senior Medicare patrol.
Yes.
And all that goes on in that, which I'm sure comes out of, we were saying all these other kind of issues lead into, this
Right.
fraud
So
prevention.
like Paula was just talking about how people are overwhelmed with all this information that they get in the mail and calls. I'm sure you've received those calls where they're telling you, I'm from Medicare and all of that,
Yeah,
right?
yeah.
So, first of all, Medicare fraud costs the taxpayer in the country $60 billion
Oh
a
my
year.
gosh. Wow.
So $60 billion is basically wasted,
Stolen.
right? Stolen from the
Yeah.
taxpayer.
Yeah.
And so this program, what it does is what we try to do is alert the public to let them know that these scams exist. The scams are so pervasive that we have something called the fraud of the month, because
wow.
Oh my
Goodness.
gosh.
if there's
wow.
something happening
Yeah.
in society, there's a fraud for it.
Yeah.
So when COVID came out, there's
Oh,
a
yeah.
COVID
Yeah.
fraud.
Yeah.
When they changed the Medicare card, remember they changed your
Mhm.
numbers
Yes,
and
yes,
everything.
yes. Oh my
All of a
goodness.
sudden you had people calling you up. Oh, do you want we're going
extra card.
an
Right,
extra
right.
card. We're going to
What's your
give you
number?
yeah.
Yeah.
And so the idea that if you don't hear anything else that I said, Medicare, Social Security, the IRS do not call you up. So if anybody ever calls you saying, "Hi, I'm from the IRS," I got a text the other day saying, hang up, because they do not call you. They do not call. The other thing that they do is, for example, the other day we got a call from this lady who her doctor's office called. Sometimes they know all your information.
Right.
Yeah.
She's like, well, but they knew my doctor. They said they were calling from the doctor's office. They knew my address. They knew all of these things. And so I thought it was them. So what they're calling is to confirm your number. So they'll say, oh, so this is the scenario. Oh, hi, Mrs. X. This is from your doctor's office, and we just changed our system. So we just wanted to make sure that we had the correct Medicare number. Is this your number?
Yeah.
And when you say yes, or you give
Right.
them the number, then you
So
gave
they
them
have
the
access, yeah.
confirmation, and then they start
They have the whole
defrauding your
package
account.
now.
Exactly.
Yeah.
What they're looking for is the confirmation.
Right.
So it's important never to give out your information at all to anybody, especially people you don't know. But number 2, anybody calling you on the phone, you don't need to, if it's
Like
your
ever,
doctor,
period.
yeah,
Don't
ever,
ever-
just
Don't
hang
answer.
up.
Right.
You don't, and don't say yes either, because now with all this AI going on, what they're trying to do is
Just get your
capture
voice.
your,
Yeah, your
voice.
voice.
And then they start saying, well, she, opted into this, and this. See, we have it here. So it's important not to even say yes. If anybody says, hi, are you Mrs. X? Who's calling?
Right.
Or no, and just hang up. The other thing is, because it goes, it's just a whole system, step by step. They spoof the phone. So sometimes we think we're talking to somebody, right? Because you see the caller
Right,
ID.
right.
It might be your
Yeah.
doctor's office. It might be your daughter or something like that, or somebody you think you know. It's not. They have the ability to change the number that appears on the caller ID, and you think you're talking to
Yeah, that was
somebody.
a new one that
Yeah.
I
Yes.
read when, about, preparing
Yeah.
for this, and that's a dangerous one.
That's very
Yeah.
dangerous.
Because now all of a sudden, like normally we don't answer the house. We have a
Good.
house phone
Mhm.
because otherwise our internet and
Right.
and
Oh,
our
right, right.
bill
It's
is
actually
going to go
cheaper.
up. Right?
Yes,
That's the
exactly.
only
Yeah.
reason we have it.
Yep.
Because if you take it away, everything else
Goes
goes
up.
up. So, but we don't answer it. And typically you have the caller ID up on the TV
set.
screen.
Yeah.
And what you're telling me now is that, okay, you see the caller ID and it says Paula Ewell.
Right. No,
I
I
said,
can pick
well,
that
I'm
one
Yeah.
pick
up.
it up.
Right.
Right.
And
And it
now
doesn't
that's not
necessarily have to be
reliable
her.
anymore either.
Exactly.
Yeah.
Best thing is, I always say, if
Don't pick up.
Yeah, don't pick up the phone.
I don't
Right.
pick up.
No, I'm
If
just saying,
you
but any
leave a
reason-
message. Most
Even
people do
Kristina
not
Lou,
leave
Exactly.
you don't
messages.
pick
Yeah.
it up.
exactly
Yeah.
what you're
Right.
saying.
Yes.
If it's somebody that wants to
That
speak with you,
important.
they'll leave you a message and you could call them back
Right.
to the number that you know, right?
Yeah,
Yeah.
right. That's a good point too, by the way. Do
Right.
not call the number that they left if it's
Exactly.
your oil company
Right.
uh,
Or your credit card company.
or your credit card. Call the real number. Don't call that number
Exactly.
because that number is probably a bogus number of some kind.
Yeah. Well, it's the number
and
for the fraudster. So then they'll say, "Oh, great. You called back. What is your number again? So I can find your name." And
Yeah,
then you give
it's-
it to them and they've got it.
Tough.
It's important because a lot of people feel bad that they fell,
Yeah.
to
like
a
you're
scam.
taught, we
Shamed.
taught
And
to
that's-
be
we
respectful. and
we
to-
talked about
Right.
that all the
But
time.
it's also,
Yeah.
and it could be
Yeah.
isolating.
Yeah.
Because I've heard many people say, I don't want to tell my children that I fell for a
Yeah,
scam
'cause it
because
make
they're
you-
going
right,
to
you
put
feel-
me in a
yeah,
nursing home.
yeah.
They're going to think I'm not.
That's the number one biggest problem, because
Yeah,
on this show, we
right.
always try and talk about scams
Right.
that are, because there's a new one, as you said, every day.
There's a
yeah.
thousand of them.
And
I
it's, but it
Yeah.
is, it's that shame factor. And I love that, you in the New York Senior Medicare Patrol had those, like the protect, detect, and report, because all three of those pieces are so huge in trying to get, ahead of the game in these situations.
Exactly. Yeah. And really the same way that you and I wake up every day to go to work, these scam artists, that's
Yeah,
what they
they
do
do.
for
It's
their
their job,
job. So
right.
they're very talented people. I always say if they put their energies into something
Good,
productive,
it'd
they'd
be
be
great,
very, very
right.
successful. But the other scam, a big scam, is the durable medical equipment.
Yeah.
So they'll call you on the phone and they'll offer you a back brace, right? And you'll say, sure. Oh, because it's free.
It's covered by Medicare.
Right.
So give us
But
your-
they'll say
right.
it's free. Oh, okay, free, great. And but give me your Medicare
Right.
number so that I
Right.
could do it, right? And the reality is that if you're getting a back brace, your doctor is the person who should be,
Yeah.
Ordering a prescription for
right,
Yeah.
because that's a personal thing. That's
Right.
custom fitted to your body. And the sad thing is that if you get that and Medicare pays for it and you didn't say anything, the day that you really do need a back brace, Medicare is
say,
going to
"No, we
say,
already did
right,
it."
they'll
Right.
deny it.
We
They'll
already
say,
gave you a back brace.
Yeah.
right.
Maybe you didn't even need a back brace. and they
Right.
just
Right.
put
But if
an
you do
order
need
in
one,
for
you're
a
out of
back
luck.
brace.
And what they're giving you is something like that costs $2.99 from the
Amazon,
discount
right? You
store.
just,
Yeah.
right, yeah.
Well, it could also
But
be
that they're
shipped-
charging like for
the
they're
back brace
charging.
could be shipped to some bogus address as well.
We have people who have received 200 and 300, catheters.
Yeah.
People that don't even need a catheter get
Right.
300 at a time right there because it's just once they get a hold of your number, and your Medicare number is super valuable.
Yeah.
Every time a person, they sell it on the dark web, it's $1,000 every time, and they keep
Wow.
on selling it.
My
So that's
gosh,
how they
yeah.
make all of their money. The other
Mhm.
thing is that these are rings of thieves that are not necessarily just in your community. So that's why we always say, people say, well, if I, what difference does it make if I report it? It's just me. No, it's not just you. And these rings go from
Yeah.
California to
Global.
Florida.
Yeah.
Yep.
Mhm.
And so it's a whole, it's a whole ring of thieves. And to bring them down, it takes all of us to
Right,
do that
yeah.
type of reporting. And it's billions of dollars. Like I just said, $60 billion. And I'm being, I think I'm being conservative, but that's
Yeah.
the statistics they give us.
Yeah, because I mean, everything that's underreported, like who knows,
Right.
You know, one of
Exactly.
the problems I see that in detecting Medicare
Yeah.
fraud, and we talked
Mhm.
about this before the show today, is a lot of us now go for the paperless approach. All right.
Right.
Yeah.
So you end
Yeah.
up with your paperless email that says your Medicare summary notice is here.
Yes.
And then you say, I don't have time for this right now, because you're going to have to put your username and your password in. And I'm thinking that there's got to be a way that that issue can be made easier without it becoming a fraud problem. You know what I'm saying? Like when
right.
you get the thing in the mail, you read it and it's there. When you get an electronic version of it,
Well, Otto could have you all day,
Oh,
but
yeah,
please
well-
call the toll-free helpline 1-800-333-4374 for any questions. I want to thank you so much. So great. Maria Alvarez, Executive Director, New York StateWide Senior Action Council. We'd like to thank everyone who listened and joined us today. You're listening to Project Independence and You on LIU Public Radio.